Now let's talk about log dose response curve or log DRC. It is very important topic. It is repeatedly asked in the FMG exam. In log DRC, we find two things. The first one is potency and the another one is efficacy. Let's remember some important points about potency and efficacy. For potency, I want you to remember look for left to right. More the curve on left side, more potent the drug is. More the curve on a right side, less potent the drug is. Drug A is most potent, drug D is least potent. As I can show you here in the graph, as you can see here, curve A is on extreme left position. It means the drug A is most potent, and the drug D is on extreme right position. Therefore, the drug D is least potent. I hope this is clear. What is the order of potency? A is more potent than B, B is more potent than C, and C is more potent than D. Now, this is the order of potency. Now, let's see efficacy. For efficacy, I want you to remember look for height of curve. Look for height of curve. Higher the curve, more is the efficacy. Lower the curve, less is the efficacy. A and D are equal efficacious. B and D also have equal efficacy. Let's see. As you can see, A and D have equal efficacy. Why? Because they have equal height. B and C also have equal efficacy because they have equal height. But B and C are more efficacious than A and D because B and C have more height than A and D. I hope this is clear. As I have written here, B and C are more efficacious than A and D. Now let's see this question. Which of the following statements about the given graph is false? We have to find false statement. A option is the efficacy of drug B and C are equal. B and C are equal efficacious. Why? Because they have equal height. This is the right option. Drug A is most potent. Yes, drug A is most potent because it is on extreme left position. Drug C is less potent and equally efficacious to drug B. Yes, it is also correct that drug C is less potent. Why? Because it is on extreme right position and equally efficacious to drug B. Yes, they have equal height, that's why they are equally efficacious. Drug D is most efficacious. No, it's wrong. Most efficacious drugs are drug B and C. Drug D is least potent drug because it is on extreme right position. Now let's talk about another important topic, that is Alzheimer's disease. Alzheimer's disease is also known as senile dementia, in which there is loss of memory. In Alzheimer's disease, there is loss of cholinergic neurons. Cholinergic neurons secrete acetylcholine, and there will be loss of acetylcholine, decreased amount of acetylcholine in the Alzheimer's disease. A for Alzheimer's, A for acetylcholine. The drug of choice for Alzheimer's disease are donepezil, rivastigmine, and galantamine. These drugs help to acquire and retain memory. Now let's see antidepressant classification of drugs. We have SSRI, SNRI, NDRI, and 5-hydroxytryptamine 1A partial agonist. SSRI means selective serotonin reuptake inhibitors, which include fluoxetine, escitalopram, and sertraline. The highlighted drugs are very important to remember. Then we have SNRI, selective noradrenaline reuptake inhibitors, which include duloxetine, venlafaxine. This question have been asked that which of the following is SNRI. SNRI includes vanilla vaccine, and this was the question asked. It also includes milnacipran. Then we have NDRI, norepinephrine dopamine reuptake inhibitors, which include bupropion. As I have told you, bupropion is an anti-smoking drug, which is actually antidepressant. It is the antidepressant drug used as anti-smoking purpose. Then we have 5-hydroxytryptamine 1A partial agonist, which includes buspirone. Now, now let's talk about what is ductus arteriosus. Ductus arteriosus is a short vessel. It is a small vessel which connects fetal pulmonary artery to aorta. This is the aorta. This is the aorta, and this is the pulmonary artery, and this is the short connection which is known as ductus arteriosus. This ductus arteriosus closes after the birth. After the birth. Now let's see a question that which of the following drug is preferred for the closure of ductus arteriosus in preterm baby with patent ductus arteriosus? If after the birth this ductus arteriosus is patent, that is the abnormal condition. For that we have to give some drugs to close this connection. Now let's see, guys. Prostaglandins keep ductus arteriosus open. They keep ductus arteriosus open. If we want to give some drugs which can keep ductus arteriosus open, the drugs are prostaglandin analogs like L-prostadil. It is a prostaglandin analog and can be used to keep the ductus arteriosus open. Now, NSAIDs. NSAIDs are going to inhibit the formation of prostaglandins, and therefore they are used to close the ductus arteriosus. In NSAIDs we use ibuprofen, indomethacin, also aspirin. These three drugs we can use to close the ductus arteriosus. Ibuprofen is safer than indomethacin to close ductus arteriosus. And in this question the answer will be ibuprofen, because it is better drug than indomethacin, or it is safer drug than indomethacin. Now let's see digoxin. Digoxin is sodium potassium ATPase pump inhibitor. Once this pump is inhibited, there is increased calcium in the cytoplasm. The calcium will increase in the cytoplasm, and the calcium is responsible for increased contractility of the heart. Digoxin is mainly excreted by kidneys, therefore it is contraindicated in renal failure. What are the adverse effects of digoxin? It includes nausea and vomiting. Vomiting is the most common side effect. It also can lead ventricular bigamy, and it is the most common arrhythmia caused by digoxin. Digoxin can also lead to xanthopsia, that is yellow vision, and digoxin is one of the disco drugs that can lead to gynecomastia. Drug of choice for digoxin induced arrhythmias is lignocaine, or also we can use phenytoin. For severe poisoning we use antidote. For severe poisoning of digoxin we use an antidote known as digibind. Now let's remember some important points about the magnesium sulfate. Mag sulfate is a bronchodilator. Also it's a uterine relaxant. It is drug of choice for eclampsia. Eclampsia means gestational hypertension with the seizures, that is known as eclampsia. It is also drug of choice for long QT syndrome, which is also known as toss at these points. Drug of choice for mag sulfate toxicity is calcium gluconate. Now let's talk about some insulin preparations. We have regular insulin. Regular insulin is the only insulin which is given IV. Okay, this regular insulin can also be given subcutaneous, and it is used in emergencies like diabetic ketoacidosis, hyperosmolar non-ketotic diabetic coma, and hyperkalemia. Remember, in hyperkalemia, we use regular insulin, but with regular insulin, we also use dextrose. I hope this is clear. In diabetic ketoacidosis, most common cause of death in diabetic ketoacidosis is cerebral edema. Already asked MCQ in the FMG exam. We have long acting insulin which never attains peak, which are also called as peakless insulin, which include glargine. Then we have rapid acting insulin like lispro, aspart, glulisine. Now let's see. Remember, all insulins are safer in pregnancy. Now we have a topic known as paroxysmal supraventricular tachycardia or PSVT. Paroxysmal means sometimes, for a brief period of time. In this condition, for a brief period of time, the patient will be having heart rate more than 150 beats per minute. The patient will be having palpitations, syncopical attacks, and these symptoms will be for a brief period of time. And in ECG you will see absent P wave. And for PSVT management, for prophylaxis, if you want to prevent the attack of PSVT, you will give verapamil, calcium channel blocker. For stable patient, suppose if a patient comes to you and he is saying, doctor, I had attack of paroxysmal supraventricular tachycardia. Now now you will do the acute management of this patient. What you are going to do is, now the patient is stable, you can do carotid massage, or you can give IV adenosine. IV adenosine is the drug of choice for stable patients. In MCQ, if you will see the carotid massage, mark that. If you will see adenosine, mark that. For unstable patients, you need to do cardioversion, that is DC shock you have to give. Now we have an important topic, that is malaria. Let's first talk about cerebral or complicated malaria. Cerebral malaria is also known as complicated malaria, in which you will see the history of fever, chills, rigor, confusion, and delirium. Confusion and delirium are the important points which will be given in the MCQ. And the drug of choice for cerebral malaria is artesunate IV. IV artesunate is the drug of choice. Now we have artemisinin combination therapy, that is ACT, which is used for falciparum malaria. This ACT is used in the northeast areas like Assam, and it can be used in rest of India. But the combination of drugs in the ACT is different. If a patient belongs to northeast like Assam, we use artemether plus lumefantrine. If the patient is belonging to rest of India, then we use artesunate plus combination of sulfadoxime and pyrimethamine. Very important. Now malaria prophylaxis is very important. You have to remember every important point. Malaria prophylaxis is given to traveler who is going from non-endemic area to the endemic area. Now we have two types of prophylaxis. One is called short-term prophylaxis. Another is called long-term prophylaxis. If a person is going to if a person is going to endemic area for less than 6 weeks, then we have to give doxycycline which is given daily, and we have to start it 2 days before, 2 days before journey to 4 weeks after journey. If the stay of a patient is more than 6 weeks in the non-endemic area, sorry, in the endemic area, then we have to give mefloquine, which is given weekly, and it is started 2 weeks before journey to 4 weeks after the journey. I hope this is clear. Now let's see this question. A 45-year-old patient with osteosarcoma was started on methotrexate. What lab parameter you need to monitor while giving methotrexate? See, methotrexate decreases folic acid. It decreases folic acid, therefore can lead to megaloblastic anemia. Also remember, methotrexate is hepatotoxic. If methotrexate is hepatotoxic, we have to do LFT, liver functioning test. The answer will be LFT. Antidote for methotrexate toxicity is folinic acid, which is also known as leucovorin. Now, remember, cyclophosphamide is an anti-cancer drug. It can lead to hemorrhagic cystitis. Hemorrhagic cystitis. To prevent the hemorrhagic cystitis, we have to give a drug known as Mesna. Now let's see another important topic, that is diuretics. Diuretics is very important topic. For that, I want you to look at this diagram. This is the proximal convoluted tubule, and this is the loop of Henle. Loop of Henle is having thin descending loop, thin ascending loop, and thick ascending loop. It is also having DCT, that is distal convoluted tubule. This is collecting duct. Now let's see these drugs. The first class of drugs is carbonic anhydrase inhibitors. What are diuretics actually? Diuretics are responsible for excretion of sodium and water. They are responsible for excretion of sodium as well as water. Now we have a class of diuretic that is known as carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors work in the proximal convoluted tubule. Example of drugs are acetazolamide and dorzolamide. Then we have loop diuretics. They work on thick ascending loop of Henle, and they inhibit sodium potassium 2 chloride symporter. Very important. And the drugs include furosemide and torsemide. Then we have thiazides. Thiazides works at early DCT. Here. They work here. Early DCT. This is the site where they work. And this was the question in the recent FMG exam. Thiazides work on early DCT and they inhibit sodium chloride symporter. The drugs include hydrochlorothiazide, chlorothiazide. Very important. Then we have potassium sparing diuretics. It means there will be loss of sodium, but they are potassium sparing diuretics. They will spare the potassium, okay? They work on the collecting duct. The drugs include aldosterone receptor antagonists and epithelial sodium channel blockers. Aldosterone receptor antagonists include spironolactone and eplerenone. Epithelial sodium channel blockers include amiloride and trimterene. Remember a mnemonic PAST. P for potassium sparing diuretics, A for amiloride, S for spironolactone, T for trimterene, E for eplerenone. This spironolactone causes gynecomastia because it is one of the disco drug. Eplerenone does not cause gynecomastia. Remember, in diabetic insipidus, there is ADH deficiency. If there is antidiuretic hormone deficiency, there will be excessive amount of urine. There will be formation of excessive amount of urine. We have central diabetes insipidus, which is also known as cranial diabetes insipidus, in which we give desmopressin as a drug of choice. In nephrogenic diabetes insipidus, the drug of choice is thiazides. Now we have another group of drugs known as statins. Statins are HMG CoA reductase inhibitors. They include atorvastatin or rosuvastatin. They are drug of choice for hypercholesterolemia. Then we have another group of drugs known as fibrates. They are PPAR alpha agonists. Once they stimulate PPAR alpha receptor, they increase lipoprotein lipase activity and decrease triglycerides. The drugs include gemfibrozil, clofibrate, fenofibrate. Fibrates have maximum triglyceride lowering potential. Therefore, fibrates are used in hypertriglyceridemia. We have a drug known as vancomycin. It is drug of choice for MRSA, methicillin resistant staph aureus. Daptomycin is drug of choice for vancomycin resistant staph aureus. Mupirocin, it is drug of choice for nasal carriers of MRSA. It is drug of choice for nasal carriers of MRSA, methicillin resistant staph aureus.